be talking about diabetic foot syndrome, and I'm not doing that alone. I have right here with me a senior nursing officer. Her name is Akeyemi Olumide Temitope. All right.
Thank you, Mrs. Perpetual.
It's good to have you.
It's my pleasure being here.
Okay. So very quickly, let's talk about diabetic foot syndrome. What does it mean?
Diabetic foot syndrome, according to World Health Organization, is defined as the ulceration to the foot, starting from the distal part of the ankle, and it can extend above the ankle. Diabetic foot syndrome is one of the numerous complications of diabetic mellitus. We cannot talk about diabetic foot syndrome in abstract of diabetic mellitus. About 6 to 10% of diabetic patients do come down with diabetic foot syndrome if adequate care or there is a poor control of the sugar level in the blood.
All right, let's talk about the symptoms now.
Okay, there can be tingling sensation. There may be painful stimulus. In some cases, the individual may not feel any stimulus at all. There may be deformity to the limb, because once there is an open wound or ulcer, the feet or the foot would not be in the proper alignment. There will be deformity. There may be also hair loss to the feet or the foot if one of the leg is affected, and the feet if the two are affected. Once there is a poor blood supply to the leg, definitely the hair on that part will fall off. So those are the ways we can know that diabetic foot syndrome or ulcer is setting in. Also, proper inspection. And in one of the managements, we do specify and also hammer on it that there should be thorough inspection. During inspection, especially of the foot and the toes, if there is any open wound, the individual or the client would notice, and in that way, they can detect the syndrome.
All right, can we talk about the risk factors? Does it have risk factors?
Yes. Like I said, we cannot talk about diabetic foot syndrome in isolation of diabetic mellitus. One of the risk and the major factor, the risk factor, is poor control of the sugar level. In most diabetic patients, compliance is always the problem. Some do not comply with the treatment regimen being laid down. Even some, when they comply, they don't fulfill their appointment in the hospital. So this can lead to various complications setting in, and it can pose a risk if the individual is not checking the feet regularly or taking care of their feet with a cool or warm water. Then there are techniques you prevent your feet from getting injured. So those can pose risk to the client or individual. So we always advise them to do thorough inspection, because by then they would notice if there is any open wound. The injury will start a little, but if there is no proper care or diagnosis, it keeps spreading. Gangrene will set in, and before you know, it keeps expanding beyond the foot down to the leg, and it may become systemic.
All right, so I think what this means is that for people who are diabetic, we always have to sound it to them that they should, treat themselves, do what they're supposed to do, so they don't come down with this. I guess that's what you're saying.
Yes.
All right, let's talk about prevention generally then.
We have many ways of preventing diabetic foot syndrome, and the number one thing I'm going to hammer on is proper glucose control. Proper glucose control for diabetic patients. Once the glucose level is well controlled, it will reduce the damage done to the nerves and the blood vessels. So if there is no damage to the nerve, if there is any open wound, they would know, because there will be sensation. They will feel the touch, they will feel the prick, either by a sharp object or if there is any slab of whatever falling off. Then if the blood glucose is well controlled, there will be adequate blood supply to the lower limb, and thus reducing diabetic foot ulcer. Also, foot care is another aspect. Diabetic patients are not advised to wear tight shoes. Wearing tight shoes can always cause abrasion, leading to open wound. Even sometimes they will sweat in the shoes, and once there is moisture, that is wetness inside the foot, you know the skin will become soft, and before you know it starts peeling off. Even when they are home or in offices, some would not even take time to remove their shoes to inspect their legs. So we won't advise them to wear tight shoes. They should wear shoes that are free and would accommodate or allow inflow of air and oxygen supply. Also, if there is a wound, because sometimes we cannot, there are some injuries that cannot be avoided. In case of injury, they should come back to the hospital. No over-the-counter medication or whatever should be applied. In the hospital, there are experts to manage the wound. We have wound dressings. There are lotions, there are drugs that will be applied on that wound. But if the presentation is late, there may be dead tissue around the wound, and the dead tissue would be surgically removed to allow granulation, that is growing of underneath tissue, which will allow for proper healing. Another prevention of diabetic ulcer or foot syndrome, it is not advisable to use razor in cutting of the toenails. Razors, blades, they are sharps, and you know, by mistake it can cause injury. The nail cutters are always better because the two edges of the nail cutters are not sharp. There is a blunt end, and that cannot really cause an injury, unlike a razor. Podiatrists are there in the hospital for foot care. There will be thorough examination. There are tests to be carried out if truly there are good supply of blood. Even while sitting at home, they can elevate their legs on a stool or a pillow for adequate blood return. So those are the ways we can prevent diabetic foot syndrome in diabetic patients.
All right. Well, very quickly then, let's talk about treatment generally. I know there is that part where we get to talk about amputation. Am I correct?
Yes, you're correct.
Okay.
And I would say that would be the last end result. The early presentation matters. And in diabetic patients, they are always encouraged to keep up to their appointments. If the presentation is early enough, drugs can be given to bring down the blood sugar, because if the blood sugar is still elevated, there will be poor wound control. So there are drugs. We have oral hypoglycemic drugs. We have insulin, which are injectables. It depends on the physician's examination and what he found, what the glucose level is. So that is one of the care. Also, when they come to the hospital, we have dressing solutions. There must be a good oxygen supply to that wound. Wound dressing can be done. In cases where there are dead tissues around, we call it a wound debridement. That is removing the dead tissues around the wound to allow proper wound healing. There will be a good blood return. There will be inflow of oxygen to that. But in cases where there is already gangrene, infection had set in and had gone beyond measure, amputation is the result. And it's better to remove the leg before it becomes systemic.
That's another interesting conversation, I must say. Well, just before we wrap up, I'd like you to just maybe share your final thoughts with us.
Well, to the viewers at home, diabetic mellitus can be controlled. I can say it can be hereditary. Sometimes we have aged ones that we do care for, and you know, at the old age, they may not even be conversant of themselves. But we as the carers have a lot of work to do. We must monitor their diets. There are ACU checks that is glucose blood glucose parameters that can be used at home. In fact, it is advisable they have that at home for them to keep monitoring their blood sugar. We have the normal range during fasting and the random, that is when you have eaten. So it is advisable they have a small jotter with timing. So if there is abnormal increase, they would know. Sometimes some of them skip their drugs. So, and food care is another good thing. Even if the client does not have the time, the carer or the families or the relatives around can do that. Check in between toes. The in between toes must be kept dry, and the soles of the foot, the ankle, should remain moisturized. They can use a petroleum jelly just to rub, but in between the toes must be kept dry, because that is where the injuries mostly come in. Under the foot, it is not easy to detect. So that is why it is better the in-between toes are kept dry. Then the treatment regimen, though some people would say it is not an easy thing to do away with some food, but when we are alive, there is hope, and health is our wealth. Our health is our wealth. So they can reduce the diet if they want to eat carbohydrates. We have low molecular carbohydrates that can be taken, like these are local ofada rice. They have a lot of high fiber and the sugar content in them. Vegetables, fruits are good for them. Beans, fish, those are good sources of food for the diabetic patients. If they are on drugs, they should keep to the timing of the drugs. If the client is taking injections, that is insulin, they should keep to the time. And if there is any noticeable increase on the blood sugar, they should report to the hospital. So, and in case peradventure there is a wound, we wouldn't want them to stay at home. We wouldn't want it to aggravate. Please report to the hospital. National Orthopedic Hospital is always opened 24 hours. We wouldn't want it to get to the level of amputation before they report to the hospital.
All right. Thank you so much. I guess I had a great time listening to you, and I believe our audience did too.
Thank you very much.
All right. Well, many thanks for watching. My name is Perpetua Fasami Peter. Do enjoy the rest of the day. Bye for now.